I think that at some point in life, everyone wishes that there was a rule book to tell them exactly what to do. Like when your parents said to you, it's not like raising you came with an instruction manual. Thankfully, there's one area of your life where you no longer have to feel unguided, because the American Cancer Society has created a set of guidelines for your health. More specifically, a list of must-dos for the average patient, either to prevent or detect cancer early.
Their guidelines are for early diagnosis of cancer, with the hope that if you can pick up the disease, detect the disease early on, that you can nip it in the bud and keep it from becoming a problem. So they have a series of guidelines for a series of very common malignancies that can, if they were applied universally throughout the United States, would have a tremendous impact on the incidence of different types of cancer.
There are 5 common malignancies that have specific guidelines. They are prostate cancer, breast cancer, uterine cancer, cervical cancer, and colorectal cancer.
First thing we have to keep in mind that these guidelines are applied to the general population. If a particular individual has specific risk factors, then all bets are off. In general, they're going to recommend a series of things to be done over the course of a person's lifetime.
So let's go through that list of 5. The first, prostate cancer. Now this one's only for the guys, since women don't have a prostate. Starting at age 50, the average risk man should have a yearly PSA, which is a blood test that looks for prostate-specific antigen, and a digital rectal exam. That's it. Pretty easy, if not totally pleasant. Moving on to the second set of guidelines for breast cancer.
First and foremost, they recommend, as of age 20, every 3 years, that a woman be submitted to a clinical breast exam by her physician. Patient also should, on her own, and probably on a monthly basis, perform a self-breast exam. By age 40, things change. By age 40, the incidence of breast cancer is now rising, and we need to be more aggressive about screening. So what's recommended from that point on is a yearly mammography.
Sorry, ladies, those guidelines are a little more involved, especially since you do have to do them for most of your life. But as a trade-off, the guidelines for uterine cancer are super easy. For the average woman, just a discussion about the risks and symptoms with your doctor is all that's necessary. And the guidelines for cervical cancer should be taken care of during your annual routine physical.
A woman should start undergoing routine examination, which will entail a pap smear, within 3 years of having vaginal intercourse, or certainly by age 21. Pap smear should be done, if it's a standard pap smear, on a yearly basis. By age 30, if a woman has had 3 consecutive pap smears, and there's no specific risk factor, then we can consider going to a pap smear every 3 years.
And the 5th and final, colorectal cancer. Now this one everyone has to do. Beginning at age 50, patients should submit to some type of colon screening procedure. The most dreaded, but also the most effective, is the colonoscopy, which usually only is necessary once every 10 years. Now, a good thing about all these guidelines, the screenings work.
I can tell you is, at least in the past 2 years, we seem to have finally seen a decline, albeit very small, in the incidence of cancer. So something is happening. Whether we're following the guidelines, whether we're protecting ourselves, whether maybe some people are eating healthier, maybe some people are exercising more. Something seems to be stemming the tide, hopefully. We hope to see this trend in coming years. See, because what happens is when we talk about cancer, we keep talking about the cure, and we should. But if we can prevent, that'll probably be the most effective way of eradicating this disease.
Last year's annual report published by the American Cancer Society showed that the incidence of new cancer cases fell an average of 0.8% per year between 1999 and 2005. Now, less than 1% doesn't sound like much, but when you consider that for most of the 20th century we saw cancer incidences increasing, any decline is an improvement. Now we just have to keep doing these things and wait for that nearly 1% to reach nearly 100%. I'm Dr. Keller Wortham, and you're watching the eHealth Network. Stay healthy.